Hello, Facilities Division. My name is Brian Carter with Facility Safety. We hope you've had the opportunity to attend one of the town halls put on by our Associate Vice Chancellor, Doug Morton, over the last few weeks. These town halls have been designed specifically for the subject of vaccines and to help you get a little bit more informed on the vaccine process for North Carolina State University, but also information to help you make an informed decision to whether you get this or not. In those town halls, our Associate Vice Chancellor made it very clear this is your decision. And we want to help you be as informed as possible, but no one can help you as much as your family physician can. So speak to them about your condition and whether the vaccine is right for you or not. So in the town halls, we talked about Dr. Julie Kasani, that she was going to be able to be on video to give us a little bit more information. So that's what you're getting ready to hear. You're getting ready to hear Dr. Julie Kasani, who is the North Carolina State University's Student Health Medical Director. And she's going to give a lot of information about the vaccine in general, but also a little bit of the process for North Carolina State University. So let's hear from Dr. Julie Kasani.
Hi, everybody, and I'm happy to have this opportunity to talk to you about vaccines and what the COVID vaccine means on campus, and especially to you individually. Obviously, I think this is a really important topic and a really important activity that we're doing here on NC State campus. And so I'm here to try to talk and answer some of your questions, even though we're doing it in this sort of artificial environment on video. So some of the questions I get asked all the time, probably the biggest one is, how safe is the vaccine? And I totally understand the concerns and the questions and the issues. So this vaccine, all of these vaccines were developed and have gone through extensive safety testing already. The federal government several years ago developed a process where instead of taking that year or 2 year long process of analyzing the data over and over and over again, all of the safety data that the vaccine trials tell them, they figured out a system to make that shorter. It's the same scrutiny, it's the same process, it's the same safety data that they would ordinarily look at over a 2 year period of time, being what governments do, usually very slow, and compressing that into a rapid review. That rapid review is called an emergency use authorization. And they only enact those rapid reviews when there is a public health emergency so that they can get drugs and vaccines out as quickly as possible to take care of and mitigate that emergency. So all three of the vaccines that are currently available to us have come out under these emergency use authorizations, these EUAs that you've heard about. But the safety data is the same. It's the same process. It's the same clinical trials. So I get asked all the time, are the vaccines safe? The answer is yes, they are safe. They have been proven safe. They also have been proven effective. And I think that that's the second big important point to remember. Some people have been concerned that you can get COVID from these vaccines. The way vaccines work in general, and this is important to kind of understand in order to know that you can't get COVID from a vaccine, just like you can't get flu from a flu vaccine. Most vaccines take a virus that can infect you and can cause you to be sick, and we kill it. And then we inject that dead virus into you, and then your body says, oh no, danger, danger, stranger, stranger, and it starts to fight off that virus, not realizing that that virus cannot make you sick. That's what we do with flu vaccine every year. The Johnson & Johnson or Janssen vaccine works that way. It's the whole virus, it's dead, it injects it into you. Your body says, we need to stop this. I'm worried about this. This is something I don't recognize as normal. And so you get an immune response. And the next time you see it, if it's the real live virus, it fights it off so that you don't get an infection. The Moderna and the Pfizer vaccines are very different. And in fact, they're totally new kinds of vaccines where we've taken just a small piece of the virus, the mRNA, we've taken just a tiny piece of that, and because we know that that's what triggers the system to say, uh-oh, something different, danger, danger, let's fight that off. So we take that small piece, we inject that into you, your body has a reaction to it, And then the next time you see the COVID virus, the one that can really make you sick, your body says, nope, we're going to stop you right now. And you don't get sick from it afterwards. So what I've told you is that the vaccine, either the whole dead live virus or that small tiny piece, they're not the kind of virus that can make you sick. So you're not going to get sick from a vaccination. It's the whole point of the vaccination. So no, you can't get sick from it. The next question I get is, so then why do I have to keep wearing my mask, and do I still have to get tested? Right now, we ask you to still wear a mask, because just in case you get the virus you get COVID in your nose or in your mouth, you can still pass it on to other people. You won't get sick, but you could still pass it on to other people. So, you wear your mask to protect everybody else, right? So that's why we tell you to still get your mask. And right now, we're still testing everybody. I think in time, when more and more people are vaccinated and we feel a lot more comfortable with all of it, we probably will relax some of those requirements. And maybe you won't have to wear a mask, or maybe you can start meeting in public, or maybe you don't have to get tested anymore. But right now, we're still doing all of those things. So the other big question I get is the vaccine required? And the answer to that is no. We don't have any plans right now to require it of anybody. Even if I worked in the hospital as a physician, I'm not required to get the vaccine. We don't expect it to be required on campus. Could that change? It might change, but I really don't think so. And right now, our plans are not to make it required, even into the fall. So no, it's not required. So you may have some questions about what happens once you've registered or once you've pre-registered for the vaccine here at NC State. So first of all, we are really fortunate to be able to be a vaccination site and location. We will have to determine how many appointments we can give out depending on how much vaccine the state actually sends us or delivers to us every week. So you'll sign up, and then you'll get a notice that you'll have an appointment, or you need to go back into the app and go ahead and make an appointment. Once you have an appointment, you come to the clinic, you show your ID card, and you click in and register in, and then we need to register you in the state vaccination registry system. This is the system that the state, all across the state, is using to know who got vaccinated and what vaccine they got. So you'll get registered in that, you'll get your vaccine, and you'll get one of the 3 manufacturers, whichever one we have at the time. You'll get that vaccine, and then you'll go and sit in an observation area where you'll get a lot of information about what to do for yourself after the vaccination, how to sign into several different tracking systems so that we know that you're safe after you get your vaccine. And you'll get, if you have the vaccine that requires 2 doses, you'll get the appointment for your second shot at that time, so that we know if it's Pfizer, you have to come back in about 3 weeks. If it's Moderna, you have to come back in 4. If you get the Johnson & Johnson, also known as the J&J or the Janssen vaccine, it's 1 shot and you're done. You'll have a card from the CDC that tells you what dose you got and when you got it, and if you have to get a second shot, it'll be marked on there as well. So you'll have all of that information when you leave the clinic at that time. So why should you get vaccinated at all? You should get vaccinated, first of all, for yourself. You want to be protected. You are out in the public. You are face-to-face with people all the time. The virus is still here, and it will be here for probably quite a while. So you want to get protected yourself. You should get vaccinated for your coworkers and for your family, because you won't be infected, so you won't be able to pass it on to other people, especially if you have other people at home or that you work with who are older, who have medical conditions that make them sicker if they should get COVID vaccine. And this way we can all protect each other and we can get back to normal. I got vaccinated as a healthcare provider, and what I tell people is after I got vaccinated, what it does for me, I still wear my mask, I still wash my hands, I still stay 6 feet apart from people, but I'm not paranoid about it. I'm not panicking about it. If I go to the store and somebody's standing close to me, I don't jump away. I actually just step away calmly. So it gives me a sense of security. It makes me feel a lot better about being out in public. And until we can get past this and we can all get vaccinated, we can all get back to normal if we can just try. And we're all here for the students. It'll get the students back to campus, and it'll get us back to the things that we love to do and the reason why we work at NC State.
We want to thank Dr. Ghasani for her time to sit with me and make this video and give us the important information that she has. Hopefully you're going to be able to attend one, if you haven't already, one of the town halls to get some additional information. We're going to put a website on the screen so that you can go and you can pre-register off of that site or find additional information. So we hope you're doing well. Remember, we care about you. That's why we're doing this, is to help you make an informed decision for you and your family. So go pack, no one gets hurt, go for zero.